My name is Dr. Alfred Okeke. I'm a diabetes and endocrine specialist with Wayne Health Medical Clinics in Goldsboro. We have a very alarming rate of diabetes in the world, primarily because of what we do. Our lifestyles have changed in terms of less of physical activity, less exercise, and a lot of eating. A lot of our eating habits contributes to, our weight gain, and which has a very, very direct link to our having diabetes. In fact, there has been a new terminology coined called diabesity, which kind of links obesity and diabetes in one single word. So that kind of shows you the strong relationship between obesity and type 2 diabetes. The type of diabetes that is directly related to obesity will be the type 2 diabetes. Especially type 2 diabetes used to be called adult onset diabetes. And part of the reason we no longer use that term is that we are beginning to see a lot of children being diagnosed with type 2 diabetes at a very young age. A fraction of people who develop diabetes might have the classic symptoms of diabetes. Usually they might be having to drink a lot of water, urinating a lot, feeling hungry all the time, and weakness. And in some people, that can even manifest with significant weight loss. However, a lot of people may never know that they may never have these symptoms, and they may only be diagnosed by monitoring or looking at their glucose levels. If you have a family history of diabetes, that kind of expresses your genetic predisposition to diabetes. There are some ethnic people who have a much higher risk of diabetes: African American population, Native Indians, people of Hispanic descent. If you have diabetes, then you have a high risk of developing some diabetic complications. You've heard about people losing their feet from diabetic complications. People can lose their eyesight from diabetic complications. And a lot of people who are on dialysis from kidney failure as a result of diabetes. For people who do have the risk factors, then I encourage people to screen for diabetes. And screening is very easy. It only consists of a simple finger-stick blood glucose assay. And based on that, we can recommend whether you're going to require a diagnostic test for confirming the diagnosis of diabetes. If you are unfortunate to develop diabetes, I think it's pertinent that you consider significant lifestyle changes, and that will also reduce your need for medications going forward. At Wayne Health Medical Clinics, we have a diabetes and endocrine specialty, and I think we are willing and we are able to help the community at large in educating people about diabetes and taking care of their diabetes.